Hey guys, this is High Yield Anatomy Review for back. Listen to this passively for your knowledge review. Let's get started. Hyperkyphosis is characterized by a hunchback due to abnormal increase in curvature of the thoracic region of the vertebral column. Hyperlordosis or swayback is an increase in lumbar curvature of the spine. A crush fracture is characterized by compression of the entire vertebral body. The ligamentum flavum connects the laminae of two adjacent vertebrae and forms the posterior wall of the vertebral canal. The dorsal scapular nerve from the ventral ramus of C5 is responsible for innervating rhomboids, major and minor. Herpes zoster is a viral disease that remains latent in the dorsal root ganglia of the sensory nerves, and when the virus becomes active, presents as a painful skin lesion. Disc herniation in the lumbar region between L4 and L5 affects the L5 spinal nerve roots. A lumbar puncture is performed by taking a sample of CSF from the lumbar cistern, the subarachnoid space below the spinal cord, between vertebrae L4 and L5, or sometime between L3 and L4. The highest points of iliac crest are used as a landmark for locating the position of L4 to L5 for a lumbar puncture. The anterior longitudinal ligament lies anterior to the vertebral bodies along the vertebral column. Compression of nerves at the intervertebral foramen indicates a disc herniation. A disc herniation is characterized by protrusion of the nucleus pulposus through the annulus fibrosus posterolaterally into the spinal canal or intervertebral foramen. The thoracodorsal nerve innervates the latissimus dorsi, one of the major muscles, the adduct, and medially rotate the humerus. The long thoracic nerve innervates the serratus anterior, which is responsible for elevation and protraction of the scapula beyond the horizontal level while maintaining its position against the thoracic wall. The rotator cuff muscles are common sites of damage during shoulder injuries. These muscles include the supraspinatus, infraspinatus, teres minor, and subscapularis, the sits muscle, SITS. Spina bifida is a developmental condition resulting from incomplete fusion of the vertebral arches within the lumbar region. Spina bifida occulta commonly presents asymptomatically with midline lumbar cutaneous stigmata such as a tuft of hair and a small dimple. Somatic afferents are responsible for conveying pain, pressure, touch, temperature, and proprioception to the CNS. Afferent fibers carry only sensory stimuli, whereas efferent fibers convey motor information. Efferent fibers, motor, is with the E. Afferent fibers are sensory, is with an A. CSF is found within the subarachnoid space and is continuous with the ventricles of the brain. CSF flows from the ventricles to the subarachnoid space. The posterior longitudinal ligament is the only ligament spanning posterior aspect of the vertebral bodies and intervertebral discs. The sympathetic division of the autonomic nervous system is primarily responsible for vasoconstriction. The diaphragm is innervated by phrenic nerve, which arises from C3 to C5. C3-4-5 keeps the diaphragm alive. The anterior longitudinal ligament runs along the anterior-most aspect of the vertebral column from C1 to the sacrum and would therefore be unaffected by laminectomy. The vertebral canal is the longitudinal canal that extends through the vertebrae, containing the meninges, spinal cord, and associated ligaments. Lumbar puncture is generally performed at the level of C4 or C5. The anterior spinal artery is located anteriorly along the spinal cord and is not directly associated with the vertebrae. Scoliosis is defined as a lateral deviation of the spinal column to either side. The thoracodorsal nerve innervates the latissimus dorsi, which has no direct action on the shoulder girdle. The transverse ligament of the atlas anchors the dens laterally to prevent posterior displacement of the dens. The iliocostalis thoracis muscle is found in the deep back and functions to maintain posture. The pedicles are bony structures connecting the vertebral arches to the vertebral body. The ligamentum flavum runs on the posterior aspect of the vertebral canal and is more closely associated with the laminae than to the pedicles of the vertebrae. The internal vertebral plexus of Batson surrounds the dura mater in the spinal epidural space. Hence, the bleeding would cause the hematoma in that space. In the lumbar region, spinal nerves exit the vertebral column below their named vertebrae. In an L4-L5 intervertebral disc herniation, the L5 spinal nerve would be affected. Posterior intercostal arteries supply the deep back muscles, which are responsible for extending and laterally bending the trunk. The atlantoaxial joint is a synovial joint, responsible for rotation of the head, not flexion, abduction, extension, or adduction. The internal vertebral plexus of Batson lies external to the dura mater in the epidural space. The head of the rib has two facets. The rib articulates with the superior facet on the body of its own vertebrae and with the inferior facet on the body of the vertebra above. The teres major is responsible for adduction and medial rotation of the humerus. The teres minor is responsible for lateral rotation of the humerus. The triceps brachii is responsible for extension of the forearm. The supraspinatus is responsible for the first 0 to 15 degrees of abduction. And the infraspinatus is a lateral rotator. The infraspinatus is responsible for lateral rotation of the humerus along with teres minor. When a lumbar puncture is performed, the needle must penetrate the ligamentum flavum, the dura mater, and finally the arachnoid mater to reach the subarachnoid space where the CSF is located. The subarachnoid space containing the CSF is located between the pia and the arachnoid mater. General somatic afferent fibers are conveyed from the skin of the back via the dorsal primary rami. The conus medullaris is located at the L1 to L2 vertebral level. If the protrusion contains only meninges but no CNS tissue, it is known as spina bifida with meningocele. Somatic afferent fibers convey localized pain, typically from the body wall and limbs. Visceral afferents convey autonomic nervous system sensory information. Batson's venous plexus in general is a valveless network of veins located in the epidural space of the vertebral canal. The lack of valves can provide a route for metastasis of cancer, for example, from prostate or breast to brain. The trapezius and sternocleidomastoid muscle is innervated by the spinal accessory nerve. The deltoid is innervated by axillary nerve derived from C5 and C6. The diaphragm is derived from the phrenic nerve C3 to 5. C3, 4, 5 keep the diaphragm alive. Spinal bifida cystica refers to spina bifida with the meningocele or myelomeningocele. The lumbar triangle of Petit is bordered medially by the latissimus dorsi, laterally by the external abdominal oblique, and inferiorly by the iliac crest. The floor of Petit's triangle is formed by internal abdominal oblique and is a possible site for herniation. Intervertebral disc herniations occur when the nucleus pulposus of the intervertebral disc protrudes through the annulus fibrosus into the intervertebral foramen or vertebral canal. The most common protrusion is posterolaterally, where the annulus fibrosus is not reinforced by posterior longitudinal ligament. Caudal anesthesia is used to block the spinal nerves that carry sensation from the perineum. This procedure is commonly used by anesthesiologists to relieve pain during labor and childbirth. The sacral cornua lie on either side of the sacral hiatus, from which one can gain access to the sacral canal. This is the best landmark for administration of anesthesia. The suprascapular nerve passes through the suprascapular notch deep to the superior transverse scapular ligament. This nerve is most likely affected in a fracture of the scapula. Klippel-Feil syndrome is a congenital defect in which there is a reduction or extensive fusion of one or more cervical vertebrae. It often manifests as a short, stiff neck with limited motion. Spondylolisthesis is an anterior vertebral displacement created by an irregularity by the anterior margin of the vertebral column such that L5 and the overlying L4 and sometimes L3 protrude forward rather than being restrained by S1. Chiari-2 malformation results from herniation of the medulla and cerebellum into the foramen magnum. The odontoid process, or the dens, projects superiorly from the body of the axis and articulates with the anterior arch of the atlas. The anterior longitudinal ligament is a strong fibrous band that covers and connects the anterolateral aspect of the vertebrae and intervertebral discs. It maintains stability and prevents hyperextension. The denticulate ligaments are lateral extensions of the pia mater that attach to the dura mater between the dorsal and ventral roots of the spinal nerves. These ligaments function to keep the spinal cord in the midline position. The posterior longitudinal ligament supports the posterior aspect of the vertebrae within the vertebral canal. The tentorium cerebelli is a layer of dura mater that supports the occipital lobes of the cerebral hemispheres and covers the cerebellum. The ligamentum flavum helps maintain upright posture by connecting the laminae of two adjacent vertebrae. The nuchal ligament is a thickening of the supraspinatus ligaments extending from C7 vertebrae to the external occipital protuberance. The region bounded by the upper border of latissimus dorsi, the lateral border of the trapezius, and the medial border of the scapula is known as the triangle of auscultation. Lung sounds can be heard most clearly from this location because minimal tissue intervenes between the skin of the back and the lungs. The latissimus dorsi, external abdominal oblique, and iliac crest form the border of Petit's inferior lumbar triangle. The great radicular artery of Adamkiewicz is important for blood supply to the anterior and posterior spinal arteries. The location of this artery should be noted during surgery because damage to it can result in dire consequences including paraplegia, loss of all sensation and voluntary movement inferior and at the level of the injury. Scoliosis can be secondary condition in such disorders as muscular dystrophy and polio, in which abnormal muscle does not keep the normal alignment of the vertebral column and results in a lateral curvature. The intervertebral disc consists of an outer annulus fibrosus and inner nucleus pulposus. The tensile strength comes from the annulus fibrosus, which limits rotation between vertebrae. Notochord remnant forms the gelatinous nucleus pulposus and the surrounding mesenchyme, which is derived from the adjacent sclerotome, forms the concentric fibrosus annulus fibrosus. There is no direct neural crest or ectoderm involvement. Horner syndrome is characterized by, among other things, constricted pupils, sunken eyes, partially drooping eyelids, ptosis, and dryness of the skin on the face. It is caused by problems in sympathetic autonomic pathways, such as damage to the lateral horn. Horner syndrome is a result of the disruption to the sympathetic nerves whose cell bodies are located in the lateral gray horn of the spinal cord. The splenius capitis is supplied by the dorsal rami. The obliquus capitis muscles are innervated by branches of the suboccipital nerve, which also supplies the rectus, capitis, posterior major, and minor. The greater occipital nerve supplies the semispinalis capitis. The transverse ligament of atlas anchors the dents laterally to prevent posterior displacement of the dents. Scoliosis is defined as a lateral deviation of the spinal column to either side and is often associated with a rib hump, usually seen on examination when bending forward to touch the toes. In the cervical region, spinal nerves exit the vertebral column above their named vertebrae. From the thoracic region and below, the spinal nerves exit the vertebral column below their named vertebrae. Lumbar puncture is generally performed at level of L4 and L5. The spinal cord ends at the level of L1 and L2 in adults and at the level of L2 and L3 in newborns. The anterior spinal artery lies in the anterior median fissure. This artery is formed superiorly by the union of two branches that directly arise from the vertebral arteries. Hemivertebra is a condition where part of one or more vertebrae does not develop. This causes an abnormal lateral bending of the spinal column, also known as scoliosis, which may also include rotational deformities. Osteoporosis is a condition where bones become gradually less dense and may cause fractures even in minor traumas. There are 7 cervical vertebrae and 8 cervical spinal nerves. Nerves C1 to C7 exit superior to their corresponding vertebrae, whereas nerve C8 exit inferiorly to the C7 vertebra. The nerves of the thoracic and subsequent regions all exit inferior to their corresponding vertebrae. When a child is born, only one curvature is present in the vertebral column, the primary curvature, which is concave anteriorly and termed kyphosis. Sclerotomes are the derivatives of somites that develop into bone, and if eliminated, will result in underdevelopment of the vertebrae. Multifidus is a deep muscle which attaches from the transverse processes to the spinous processes, usually crossing 4 to 6 segments. The oblique radiographic view is ideal to show the pars interarticularis. The muscle that forms the lateral border of the suboccipital triangle is the obliquus capitis superior. Sacralization is a process where L5 vertebra completely or incompletely fuses with the sacrum. The radicular arteries are branches of the segmental spinal arteries. They occur at every vertebral level and follow and provide blood supply to the anterior and posterior roots. Spina bifida occulta is a developmental condition resulting from incomplete ossification and failure of fusion of the vertebral arches. In the cervical region, the spinal nerve exits in the intervertebral foramen above the correspondingly named vertebra. Therefore, C3 spinal nerve exits above the C3 vertebrae and lies directly below the C2 vertebrae. The ligamentum flavum lies within the vertebral canal on the anterior aspect of the vertebral arches, connecting the lamina of the adjacent vertebrae. Puncturing this ligament allows the needle to enter into the epidural extradural space for the injection of the anesthetic. The third occipital nerve is the medial branch of the dorsal ramus of C3. It pierces the trapezius muscle medially in the neck below the external occipital protuberance and supplies the skin of the nuchal region. The alar ligament connects the dens to the medial surface of the occipital condyles. It limits excessive rotation of the atlantoaxial joints. The rhomboid major and minor are supplied by the dorsal scapular nerve, which also supplies the levator scapulae. The function of the levator scapulae is elevation and inferior rotation of the scapulae. The long thoracic nerve supplies the serratus anterior muscle. Serratus anterior elevates and laterally rotates the scapula. The serratus anterior muscle is responsible for protracting the scapula and therefore holding it against the thoracic wall. If the nerve supply to this muscle is damaged, this will not be achieved when the patient pushes her hands against the wall, resulting in what is called a winged scapula. The long thoracic nerve innervates the serratus anterior. The primitive streak aids in the development of the mesoderm, resulting in the trilaminar disc, which contains all three germ layers. A fracture of the pars interarticularis is termed spondylolysis. An epidural anesthetic procedure is performed in the epidural space, which contains fat and internal vertebral Batson's plexus. The order of structures pierced during an epidural procedure is skin, subcutaneous tissue, muscle, supraspinous ligament, interspinous ligament, and ligamentum flavum. There is often a midline gap in the ligamentum flavum. The spinal cord ends at the level of L1, L2 vertebra, but the spinal nerve continues as the caudal equina below this level. As a result, narrowing the canal at the level of L5 will impact on all the nerves, resulting in bilateral lower limb weakness. The anterior and posterior spinal arteries do not provide sufficient blood supply to the spinal cord below cervical levels and will receive additional supply segmentally along its course from multiple sources. The largest of these vessels are usually termed the artery of Adamkiewicz and arises at the lower thoracic or upper lumbar region. A chondroma is typically a benign tumor of the cartilaginous origin, which is encapsulated. That is all I have for you guys for anatomy review for back. Good luck.